You see, sadly, many ladies have never achieved orgasm before. Now, it shouldn't be so. For a good number of those ladies, it is actually due to inadequate stimulation. However, for others, it is due to either a problem in the body or a problem in the mind. In this video, we will be looking at difficulty in achieving orgasm even with adequate stimulation, or female anorgasmia. We will be looking at the causes, the types, and we will be giving us 11 practical tips to drastically improve the chances of achieving orgasm in females. First, let me clarify. Female anorgasmia is a condition in which a lady cannot come or achieve orgasm despite adequate stimulation. Now, take note of the phrase adequate stimulation, because many ladies have never achieved orgasm before simply because they've never had adequate, proper, prolonged stimulation before. Now, it's also important to know that if you achieve orgasm from the stimulation of the clitoris and not from penile penetration, you are perfectly okay. This is actually quite common among many women because most women actually achieve orgasm only from direct or indirect stimulation of the clitoris. Also, in this video, we are not talking about low sex desire or low sex drive or low libido, and we're also not talking about not being interested in having sex or being unable to become aroused by a partner. No, we are actually talking about the inability to achieve orgasm despite adequate stimulation. There are different types. We will not go deeply into them, but briefly, it can be generalized that it happens during every sexual intercourse, or it can be situational where it only happens in certain circumstances or with certain person or certain partners. It can also be primary, where it has always been that way and started since from when you first became sexually active, or it can be secondary, where you were okay before but things got bad along the way, so it began at some point after you experienced no issues with orgasm or sex. Let's take a look at the causes quickly. This difficulty in achieving orgasm despite adequate stimulation can be caused by both physical factors and psychological factors. Some physical factors include illness, medications you are taking, hormonal imbalance. Some psychological factors include history of rape or forced sex, sexual abuse, physical abuse, emotional abuse, belief system, mood, body image, grief, depression, and so on. Some medical conditions that could actually cause difficulty achieving orgasm include diabetes, female genital mutilation, complications from genital surgeries, pelvic trauma such as a straddle injury caused by bicycle riding, hormonal imbalance, total hysterectomy, that's where the womb is completely removed, spinal cord injury, childbirth trauma, maybe from vagina tearing or episiotomy that was not properly done. Painful sex in itself can cause difficulty in achieving orgasm. Psychiatric problems, cancer, kidney failure, bladder problems, heart problems. Some drugs can cause difficulty achieving orgasm, such as depression medicine, blood pressure medicine, oral contraceptives, cancer drugs, and so on can decrease sexual desire and the ability to achieve orgasm. There are some hormonal changes that can occur after childbirth or while breastfeeding or after menopause. These can decrease sexual desire, and these also can cause changes, physical changes in the genital tissues that may reduce the overall sensation in that area, cause vaginal dryness, and painful intercourse. Now let's take a look at 11 practical solutions to help improve your chances of achieving orgasm. Number 1, perform Kegel exercises. Now, these Kegel exercises will help you to learn how to control and relax your vaginal muscles through exercise, and it has been shown to help to improve the strength and the probability of having an orgasm. It usually takes several weeks to several months for you to begin to see results, and the aim of the exercises is to help tighten the muscles of the pelvic floor, and these are the same muscles that you use when you want to stop urinating or to stop a fart. So you contract those muscles, hold for a couple of seconds, then relax, and do this as often as possible throughout the day in sets of 20. I've done an extensive video on Kegel exercise on how to do it and benefits, and I'll be placing the link to that video in the description section below or somewhere around this video. Number 2, open the lines of communication with your partner. It is important to make your partner aware of the situation you're having, the difficulty in enjoying sex and achieving orgasm. Speak openly to your partner about what you consider to be sexual satisfaction, including the things your partner does that you like and that you don't like. But most importantly, focus more on the level of intimacy between you and your partner instead of focusing on just sex and orgasm, and make out time to have sex with your partner so you can focus on enjoyment and the pleasure of the situation rather than achieving orgasm. Now, number 3, try different types of sexual position. Now, some persons have discovered that adopting only one sexual position has been robbing them of the chances of experiencing orgasm. Also, if you experience pain with one position, try several other sexual position until you find one that's comfortable and that improves your chances of orgasm. Number 4, increase the amount of foreplay before sex. Communicate with your partner in order to determine what works best for both of you and what you love. You may also need to change your foreplay styles every now and again to keep the foreplay fun and exciting. This also drastically increases your chances of achieving orgasm because it makes the stimulation adequate. Number 5, use a lubricant. Now, vaginal dryness, which can be caused by a lot of things, can make intercourse uncomfortable, painful, and makes achieving orgasm difficult. One potential simple and easy solution is to use a lubricant. There are many types of lubricants available in the market for you to try. However, be sure to read the instructions and follow the instructions carefully. And this is one very powerful way of increasing your chances of achieving an orgasm. Reduce the amount of alcohol you consume. Excess alcohol in your system has the ability to blunt your sexual responsiveness, and so cutting back on the amount of alcohol you consume may help to alleviate or remove your sexual issues that you are experiencing. Number 7, stop smoking. Smoking can restrict the blood flow in your body, which in turn means that less blood is able to reach your sexual organs. So less blood to your sexual organs can cause you to have trouble becoming aroused and also to have trouble experiencing an orgasm. Number 8, make healthy choices. Ensuring you get enough physical activity every week, ensuring you're eating properly and taking the time you need to relax once in a while can have a long-term and positive impact on your sexual experiences. Regular aerobic exercises like brisk walking, jogging, bicycling, dancing, swimming can increase your stamina and elevate your mood. Taking the time to relax now and again can help relieve stress and anxiety, help you to be able to focus on your sexual activity and increase your chances of achieving orgasm. Also consider taking up yoga. Yoga in general is a great way to increase your flexibility and balance and can reduce stress and tension. And there are even yoga poses that are designed specifically to improve your sexual performance and functioning and enjoyment. And so if you are looking for a way to increase your level of physical activity anyway, consider giving yoga a try. Number 9, attempt hormonal therapy. Now, if your sexual problem is linked to a hormonal imbalance or cause, your doctor may suggest a form of hormonal therapy. It can be estrogen therapy, where it helps to improve the vaginal tone and elasticity, increases vaginal blood flow and enhance lubrication, or it can be androgen therapy. Testosterone plays an important part in sexual functions for both men and women, and testosterone can be used off-label for increasing libido, but there's also a potential risk of breast cancer if you use it, and some of the drugs used for treatment can have severe and long-term side effects. So make sure you don't self-medicate, make sure you talk with your doctor, make sure you are careful. Number 10, make an appointment with a psychologist. Now, if you think there's no physical or medical reasons for your difficulty in achieving orgasm, or you've already been assessed by a doctor, make an appointment to speak to a psychologist who specializes in sexual problem. You and your psychologist will develop a treatment plan together. Now, you could use cognitive behavioral therapy, which is used to help to identify and change the feelings, the thoughts, and the behaviors that you have that are causing you the sexual problem. Or you could use mindfulness-based interventions. Mindfulness works by helping you to feel and understand your body and its various sensations. Number 11. Now, there are two very controversial approaches that surprisingly seem to work very well for quite a number of ladies. And number 1 is masturbation or self-stimulation, and number 2, the use of vibrators. Did you find this video very helpful? Don't forget to hit the like button and stay subscribed, and check the description section for a free ebook titled Fire Your Doctor. Take charge of your health and happiness.